how can heart attacks be prevented potentially by using drugs? I think drugs are great, and certainly we have fabulous drugs now. We did not have as many drugs as back 15, 20 years ago, but now in diabetes we have a lot of very nice drugs that have been very helpful. Probably the most life-saving drug, and should have got a Nobel Prize from my perspective, is a statin. If you can take a statin and lower your cholesterol, that statin drug does more than lower your cholesterol. So if I had one drug to say I would take a statin. And your doctor can look at your cholesterol level. Now understand, if you have diabetes, he's going to tell you the LDL, which is the actual cholesterol most people look at as LDL. He won't be talking about the totals so much, but the LDL may be kind of normal, or maybe even a little bit below normal. Even though it is, the other part that you don't see is the fact that the triglycerides are high, which is a fatty part of the metabolic section related to lipids, and the good HDL is low. What's hidden in there that you can't see is small, dense LDL particles. Statins help decrease some of that risk because it brings the triglycerides down. It has a little benefit to the HDL, but it really does bring down your LDL cholesterol. There are many world experts who think that if I lower your LDL cholesterol low enough, you won't even have to worry about the HDL being low because there's not enough cholesterol around to cause the atherosclerotic problem. So I would say take the statin. That would be the major one. Now, that's related to the lipids. Related to the actual blood pressure, we have 72 blood pressure drugs. Get your blood pressure into the right range. And there's a lot of people who can tell you whatever to take. But take one, but whatever you pick, take it. There is no drug that works if you don't take it. What is the compliance rate in 6 months after we give most patients drugs? Do you know, since this is an asymptomatic disease, what, only 1/3 of you take the drugs after 6 months? So did you think you got cured with just the drugs? They're only lowering a number. There's no cure here. This disease process will continue the rest of your life. There are many people, even presidents of the United States, that thought that their cholesterol now has been controlled so good they could just stop taking their medicines. And then they have heart attacks because it doesn't go away. You've got this and you got it for the rest of your life. So you really do need to stay tuned. Keep that cholesterol down and take your medicines your doctors give you. Now, you may not get along with some of the medicines. Then ask him to readjust those and find ones that work.